Top story on ABC News Breakfast. The federal government has finally secured the support of all the states and territories for its multi-billion-dollar health reform package. The agreement will be signed today after 15 months of often arduous negotiations.
The government has had a tough time getting Western Australia and Victoria on board. It was forced to abandon plans to use some of the state's GST money to pay for the deal.
For more, Andrew Green joins us now from Canberra. Andrew, good morning. A big victory for the Prime Minister, this one.
Absolutely. The Prime Minister, Julia Gillard, will be adding this to her list of deals and accomplishments in her so-called year of decision and delivery. Julia Gillard can now add a hospitals deal to the Malaysia asylum seeker transfer agreement, also the mining tax and obviously the carbon tax legislation and various other things that she's been gradually ticking off. But there is somewhat of an irony too that as the Kevin Rudd, the Foreign Minister, recovers in hospital from his own hospital treatment, his replacement, Julia Gillard, has finally clinched a deal that he had first signalled a couple of years back. And as you mentioned, it's been the difficulty of the states, Western Australia and Victoria, falling to Conservative governments, particularly in Victoria's case, that made it that little bit more difficult for Labor to get this across the line. Victoria had been resisting some of the increased scrutiny that was a part of this deal to provide extra funding, some $175 billion leading up to the year 2030 of extra Commonwealth money. Well, there's been compromises now on both sides, and we finally have a deal, and the Prime Minister will be making much of this today, we expect.
And in practical terms, it does mean a big amount of extra money flowing to things like inpatient and outpatient services at your local hospital.
That's right. If we look through some of the details that have been provided in the years to 2019-20, the government is saying there'll be $2 million for more services for patients admitted to public hospitals, $2.9 million for services in emergency departments, and $19 million more outpatient consultations. And this is, of course, part of a new funding model that the government has agreed to, where there has been a decline in the proportion of Commonwealth funding over recent years. The Commonwealth is now going to be increasing its share. Originally, Kevin Rudd had proposed a 60-40 split. Well, it's not quite like this with this agreement. Under this agreement, the federal government will begin paying in a couple of years' time 45 cents in every new dollar of spending, and that will gradually rise to 50 cents in every new dollar of spending. So a transformation of the way our hospital system is funded and also administered in terms of some more layers of scrutiny and perhaps accountability also for the state governments.
Finally, Andrew, it is shaping up as a pretty good day for the Prime Minister. She is desperately hoping the Reserve Bank board won't rain on her parade.
Absolutely. The Reserve Bank has sat on its hands for a number of months now, but there is a bit of a split in thinking among economists which way they may go today. There's been some fairly poor economic data in recent times, but there is also a suggestion that they may be ready to go today. And whether they do go above the official rate of 4.75, we'll know shortly. But this is what the Treasurer was saying on this topic just a few hours ago.
That's entirely a matter for the Reserve Bank. They take these decisions independently. The one thing that I'm very confident of is that we've got the right fiscal policy settings, and the Reserve Bank agrees the government has got the right fiscal policy settings. Fiscal policy will not be adding to inflationary pressures in our economy.
Wayne Swan there in the decision announced at 2:30 Eastern Time this afternoon. Andrew Green in Canberra, thank you.
Thanks, Michael.